So if you like your doctor, you might not be able to keep your doctor after all. It's a shocker, right? Now that costs for healthcare companies are skyrocketing, insurers like United Healthcare are cutting thousands of doctors from plans. Physicians in at least 10 states receiving termination letters from United Healthcare citing, quote, significant changes in healthcare. How did this promise go so wrong? Joining me now is former hospital CEO Stan Hupfeld. Stan, thanks for joining us. Explain to me and to our audience, really, the mechanism behind this. Lots of people are getting these letters, and you're seeing really great doctors, for example, Moffitt Cancer Center in Tampa, Florida, getting cut completely out of these plans, so they're no longer included. Why are healthcare companies doing this?
Well, I think it's all centered around the Medicare Advantage program, which has been very popular with Medicare patients, but has been very expensive from the government standpoint. And I believe what is happening with the cutbacks in the Advantage program through the Affordable Care Act, the cost cutbacks, many insurance companies are taking the opportunity to eliminate high-utilizing doctors from their plan.
Let me stop you right there, because I want to know what that means. What is a high-utilizing doctor? Because isn't everybody paid the same, no matter what, if you're getting reimbursements from Medicare Advantage?
Remember, on the Medicare Advantage, the reward is on a fixed payment system to the insurance companies. And so if they have a doctor that utilizes more services, recommends more x-rays, more lab tests, more hospitalization than another doctor for the same given disease, that represents a loss to the insurance company. So I think what's happening is they're looking at the utilization of their doctors and how they prescribe and how they order, and they're eliminating those doctors which appear to them to be high cost and high utilizers.
High cost and high utilizer, and maybe great results. I mean, I looked at a lot of the folks that were on this list, and you see names like Moffitt, which is the go-to cancer center if you're sick in, Western Florida. That's where people want to go. So they're high cost, I think, because they're probably providing a superior service. And before we throw the insurance carriers under the bus, the reason why they're responding to this as well is because the way we were going to pay for Obamacare was by cutting Medicare reimbursement. So they just saw the amount of money that they're getting go down dramatically. Right?
Exactly. And that's why they're taking on this move. And you have to suspect that the reasoning is, from the insurance company standpoint, that they can get very similar results to the kind of organizations that you just mentioned with less cost.
Well, I mean, before you say similar results, if it's me or if it's my family, I want to go to the #1 place in my area. I mean, if I'm going to die of cancer and I'm looking for someone to save me, I would like to go to the #1 recommended place in the area, even if they're more expensive. But it sounds like if you're on these plans now, that is no longer an option. I mean, are they, this is the trend, this is where we're going.
Yeah, I think the argument, though, is that statistics will tell you, and their utilization numbers will tell you, that they can get similar results with different doctors who have lower cost.
Okay, but if you're in this boat, and there are a lot of people out there, I mean, there are a lot of seniors who had a doctor that they were used to seeing all the time.
Right.
And they've now been told, I was reading about one lady who's over 90 years old, and she said, at this point in life, I don't really want to change anything. Now I'm going to have to change my primary care physician as a result of this. To you, it feels like I'm doing this to pay for Obamacare, which, doesn't seem like it's working out that well. It's going to be pretty frustrating to those folks. Let me just ask you, go ahead.
I think it's very uncomfortable for the patients. But we should understand that this has happened before the Affordable Care Act. Insurance companies were trimming their provider networks for a long time to gain cost advantages. So the technique is not necessarily new. The fact that it is hooked to the Affordable Care Act makes a lot of people uncomfortable.
Yeah. Let me ask you, before we run out of time, as a veteran of the healthcare industry, how easy is it to implement what the president just did, saying, with 6 weeks left to go for the year, that if your plan has been canceled, you can keep it? Is that possible from someone who's been deep in the ditches?
I would think it's extremely difficult for the insurance companies, for the insurance commissioners to do. And ultimately, I think it'll provide some real difficulties for providers as well, because they'll be dealing with two classes of patients, one with the new program, one with the old program. And it'll be hard to explain the difference. Many people have a very sketchy understanding of their policies in any case. So with this kind of confusion, it simply makes it very, very difficult, not only insurance companies, but I think hospitals and doctor offices.
Stan Hupfeld, thanks so much for joining us. We appreciate your time.
Thank you.